Dr. McDonald. I'm just going to tell everybody who's watching how this works. This is a live feed that's happening on our Facebook page. And if you have questions that you would like to ask and see if Dr. McDonald can answer them, you can just type them in there. Lana is doing some awesome magic. She is responding on behalf of Carriers County Tribal Council on her end and keeping everybody happy, and making sure that those questions get to Ewing, and Ewing is putting them onto a form for me, and then I'm going to put them to Dr. McDonald. So that is the chain of command. So welcome everybody, and thank you for being here. I see some people have already tuned into the Facebook Live, and I'm really happy. Masi Cho. Okay, well, I'll introduce myself again. Audrey McKinnon, Communications Officer for Carriers County Tribal Council. And sitting on my screen below me is Dr. Shannon McDonald, Acting Chief Medical Officer at the First Nations Health Authority. Welcome. I think you're on mute, Doctor, if you were saying anything.
I owe money to the penny jar. Every time I do that, I'm supposed to throw a loonie in the jar.
That's a good system. Did you want to introduce yourself?
Sure. Shannon McDonald. I'm calling in from Sayut First Nation, where I live as a guest on the territory. That's just north of Victoria on Vancouver Island. I am Métis Anishinaabe, originally from Manitoba. Grew up mostly in Winnipeg, but my family are from communities around the Red River Valley. Grandmother of 2, almost 3, mother of 5. So
wow,
have a previous life. Today is my first day back at work after 2 weeks off with COVID.
Did you have COVID?
I did.
Oh my gosh.
I was vaccinated on March 8th. And even though we warn people about being really cautious in the period after vaccination, and my husband and I had both been very careful, he was diagnosed first, and then I was diagnosed about 4 days after that. So
wow.
Relatively mild cases, so thank God for that. But it just showed evidence of how cautious you have to be during that period of time. We hadn't gathered with anybody. We hadn't had any company. It was, my husband had been going to work, but nobody where he works had been ill. So we're not quite sure where we came into contact, but obviously we did. So
wow.
Yeah.
Well, I'm really, really glad you're okay. And I assume your husband's turned the corner as well.
Yep, he's back at work today too. So
okay.
The dog is very confused.
Yes, all of our dogs will be so confused when we have to go back to work, to the office. I've been working at home with my dog for several months now, so he's getting spoiled rotten. And I think that, actually what you just said, I think that's going to lead to some questions as well. One of the questions that I have on the side already. So let's get to that in a second. We'll put a pin in it for now. And maybe it's a good place to, oh, sorry.
Lana's doing this.
We'll be so confused when we have to go back to work, to the office. I've been working at home with my dog for several months now. So he's getting spoiled rotten. So, and I think that, Anna, if you said, I think that's going to lead to some questions, questions that I have on the side already. So let's get to that in a second. We'll put it. Oh, okay. I'm going to send her some instructions quickly in the chat box here, just to mute the Facebook video. That's what's happening. She's on the Facebook Live with her volume up. Well, she'll hear this actually. Just mute your Facebook video and unmute your Zoom. And if you want to ask a question, then you'll be able to hear us live. Does that make sense?
I can't hear nothing now.
Okay, you can't hear us?
I mute my computer.
Maybe Ewing, can you send her some messages and see if you can get that sorted out? And let's ask Dr. Shannon McDonald just to update us. A brief overview of the situation in the region right now.
Okay, so considering I've been away for a week, it has been a bit of a challenge. And so our surveillance team, wonderful people that they are, They work with our partners at BCCDC to do a data linkage every day between the list of people who have tested positive for COVID and our First Nations client file. Since these go back to March 31st to April 4th, so we don't have data for today yet. But in that period of time, there were 55 new cases in Northern Health. So that, of course, is concerning. But all of the cases in the Prince George area were off reserve. And I do have a list of by local health area. So we see those numbers. That's a significant increase from where we were in the last couple of weeks. We've also had a report, tragically, of 5 more deaths, bringing our number to 117. And I always like to remind people that I'm not just talking about numbers, I'm talking about people. And when I talk about the people who have passed, I want to acknowledge their lives, their families, and their communities. And 4 of the 5 that we were reporting from over the weekend are people from Northern Health. So we don't like to get too specific about where people are located to respect their privacy. In terms of active cases right now, there are 124 active cases in the north and a total of 305 total active cases in the province right now. And those are both on reserve and off. We can separate them out. There's another document that I received that separates them out. What I don't have yet, and what people may have a curiosity about, we're working with our partners at BCCDC to get more information about how many of those cases may have been people who had been in contact with the variants of concern. And we don't have those numbers yet.
Right.
They are, they have numbers for the province, but we haven't, because of different computer systems, we haven't been able to do the same kind of linkage as yet, but we're working on that.
Okay. How granular does your data get in terms of understanding what the stats are, like say in individual communities, thinking of our member community specifically?
Right. So I have the unique privilege to be receiving every single day a line list. So a list of all of the individuals who have tested positive. On that line list, I get the band numbers. So I could potentially input all of those band numbers and get a list of the Carriers County communities specifically.
Right.
The challenge for us is we have rules about sharing data when there are less than 5 individuals in a particular cell size. So we may be able to now at this point in the pandemic talk about all of the cases that have happened over this whole year, but very unlikely to be able to break down to a community level or even a regional level. The numbers tend to be less than 5.
I see.
In which case I wouldn't be able to communicate that out to protect the privacy of those individuals.
Right. Particularly in small communities where everybody knows each other.
Right.
Yeah. I know, Lana, you've been itching to ask this question, and I'm just wondering what if you've figured out your audio situation, or if you want to type it, or no, haven't figured it out. Okay. We actually have a whole bunch of questions that we fielded before we got started here, and you figured out your audio situation, or if you want to type it, or no.
Well, I have a whole bunch of questions.
Okay. We actually have a whole bunch of questions that we fielded before we got started here, and you figured out your audio situation, if you want to type it, or no.
Well, I have
Okay, we'll see if we can sort that out here.
but
Here we go. Okay, I'm just going to ask these questions. We'll let Lana figure out her stuff. And thank you to Lana, actually, particularly because I know that she jumped on this at the very last minute. We had a different tech setup, and she volunteered herself. And obviously, there's a lot of technological challenges with just jumping into something like this. So I really appreciate all your help, Lana, and I hope we can figure this out. Okay, so what we've done is we've taken some questions, and I want to ask them in exactly the wording that they're in, just so that people feel like their question has really been asked, and that they've really been heard, and maybe there might be some questions that we kind of fall into from there, and some discussion that we can go into from there. So this question says, I'm just going to read it word for word. It says, why is the province allowing kids to not wear masks on the school bus, but must wear it in class? Sorry. Private schools put a rule in place to wear masks at all times. This makes no sense. As a small community, everyone knows everyone and are in the same surroundings. And so that's the full question. And I think there's a couple of different parts that come from. So I think
layers there.
Yeah, a few layers.
So I don't participate directly in making decisions. I can advise, but I don't participate in making decisions at the provincial health officer level. So the people, Bonnie Henry and her team work with, for example, the Minister of Health and the Minister of Education to make decisions about what is the safest way to interact and whether or not people should or shouldn't be wearing masks. In many places now, masking is mandatory every time a child is in the school. And that seems to have been well accepted. I wouldn't want it, my daughter-in-law is a teacher. I wouldn't want to have to be the person saying mask on over there and mask not on over there. That must drive everybody a little crazy. And when we give advice to our staff, if you are, for example, carpooling, the recommendation is for everybody in the car to be masked. So I would not be adverse to hearing that children should be wearing masks in a school bus. But we also know that children being children, they are touching their masks, they're coming off and on, they may be sliding below their nose, lots of yelling going on the school bus and things. So the utility of, you'd have to be able to monitor mask wearing in a situation like a school bus. And I would hope the school bus driver would be paying more attention to the road than whether or not Johnny was wearing their mask.
Right. What about this question of small, close-knit communities? What should people be doing to stay protected in that context?
I live on a First Nation, small, close-knit community, but apparently somebody on the community or somebody locally had an infection that they chose to share with us. With my husband and I would much rather that hadn't happened. My daughter and son-in-law and the baby came over to visit us on Easter, but they did it from the end of our driveway. We stood inside the garage and they stood at the end of the driveway and had a visit. As challenging as it is, people have to be able to make choices. If you have, all it takes is one individual who is highly transmissible in a community, no matter how close-knit, that could spread very, very quickly in a community. So our recommendation is always that the same precautions should take place everywhere.
Absolutely.
I've had some communities, for example, who have sent me email and said, well, we now have 80% or 90% of our adults have had the first dose of the vaccine. Should we open things up for the kids during spring break? Should we have a celebration in the big house? And my answer has still been, unfortunately, no. And I am the living, somewhat wheezing example of why that's not a good idea.
Yeah, absolutely. It's a tough pill for everybody to swallow, I think. How do you make that a little bit easier on people? How do you, how do you tap into that, that need for people to be able to do that?
It's really hard. I mean, I know everybody has been challenged by this, but we have to be honest with ourselves about what it is we really value about connecting with people, and doing as many of those things as we possibly can within the limits that the disease has brought to us. So no, we can't have a big holiday feast where 20 people are in the room and sharing at a table. But one of my neighbors came around and left little packages of Easter eggs on everybody's door, with a tag with their phone number reminding people that they'd love to talk to you.
Oh.
So I think there's lots of ways that we can connect as families and as neighbors and as community, without putting each other at risk.
We had a comment while you were talking from a community member named Christine Bear, and she's asked, what were your symptoms when you had COVID-19?
It was very frustrating. My husband also works in healthcare, and he got sick first. It was over a weekend, and he was kind of nasal congestion, which is unusual for him. He had a slight cough. Nothing huge, but we had talked about, well, you have symptoms, and you know, he works in healthcare. He doesn't want his staff to get sick. So he went and got tested and then got sicker. For me, it was, I have allergies, so nasal congestion this time of year is not terribly unusual, but I was going through like a box of Kleenex in a day. Had a headache, some nausea, diarrhea. But the thing that I found the most difficult was the fatigue. You know, just getting up and taking a shower. I needed to go back to bed for a nap. So it really depends. Luckily, neither one of us got sick enough to need to go to the hospital. So we're blessed that way. And having had the vaccine, probably contributed to that.
I think that's a really natural follow-up, that we really have to pull at that thread in this conversation. But this is something we're seeing in Prince Rupert as well, where they have a really high number of people who are vaccinated, yet people are still catching COVID. And actually, this question we were talking about earlier, but the question was asked, if there's no guarantee, why are we getting this vaccine? What are we getting from this?
Well, knowing that the vaccine is intended to be a 2-dose vaccine. So the first vaccine right now, the numbers vary, but we're looking at 70% effectiveness against, remembering that vaccines are not meant to keep you from getting any infection at all. Their goal is to keep you out of the hospital and keep you from dying. So it's about 70 to 75% from serious disease and illness after a first dose, up to 95%, depending on your body and how you respond to the vaccine. So my case, where I'm feeling kind of crummy for a few days, and I'm at home because I'm isolating because of a positive test, that was much better than people that had gone to hospital in ICU. And as we lost this week, 5 more people who have lost their lives. So the second dose of the vaccine is meant to be a booster. And right now the rules are set up so that, I want to go back to the evidence from Europe, because Europe was well ahead of us in terms of delivering vaccine. They have found people have had really strong immune response to the first vaccine, and that has allowed them to delay the second vaccine, the booster shot, for up to 4 months, allowing them to give lots more people the first shot, because otherwise those numbers would have been half of what we had, right? So, but the vaccine does not prevent all illness, and everybody has a different response to vaccination depending on the state of their immune system.
I see Lana put her hands up, and I'm praying that you have sorted out the audio.
Yes, I have.
Hey, there you are.
On the button. Okay, we have Mark Anthony Louis. He has asked a question. If you received a vaccine, does it have to be the same type, or are they interchangeable?
They are not interchangeable. There are slight differences between each of the vaccines. The Pfizer and Moderna vaccine are the same type of vaccine. They're both the mRNA vaccines. So there's some question, and science is still looking at whether or not you can have one and the other in the 2 doses. But at this point, it's not recommended because it's a big unknown. What we know won't work is the first vaccine being either Pfizer or Moderna, and then the second being the AstraZeneca or the new Johnson & Johnson vaccine, which are a different kind of vaccine altogether, a different technology. So it wouldn't be a good idea to mix those 2.
So I have another second part of this question. Thank you, first of all, for the first question. And second one, which vaccines are being given in Prince George and Northern Health? And has there been any cases of the variant in the Northern Health?
I don't know about the variant. Just reminding people I've been away from work for about 10 days. So I can't tell you exactly whether or not there's been variant in the North as of yet. Depending on where you live, the most remote communities, so many of the remote First Nations communities received Moderna as their vaccination. But as time went on, it was harder to get Moderna, and Northern Health started utilizing Pfizer. We didn't know a lot at the beginning about whether or not we could ship some of the vaccines safely. They had a really low temperature requirement and that sort of thing. So at first they weren't shipping Pfizer out to places where smaller populations were, but as time has gone on, they've discovered that it works just fine. And so both Pfizer and Moderna have been used in the region.
What's the current status of AstraZeneca? I know that question comes up quite a bit, but and there's been a lot of controversy around that vaccine and talk of blood clots, and I know that there was a recent change as well provincially in terms of how that's being delivered. So could you clarify what's going on with that one?
I could try, knowing that this is something that is being examined right across the world. AstraZeneca has been widely used in Europe, more than 14 million doses. And there's been about 25 recorded cases of individuals who have had issues, excuse me, with a blood clot. And there can be really serious issues, obviously. They could cause a stroke, they can cause a pulmonary embolus, so a blood clot to the lung. And there have been, I believe at last count, it was 9 people that have died. What is difficult to say is whether or not the vaccine is what caused the blood clot. Because we also know that one of the things that kills people with COVID, with the disease, is they get blood clots that can cause the same issues. And so there's a bit of a question as to whether or not the vaccine was directly responsible. The other thing that we look at is how common are these kinds of blood clots in the population to begin with, and whether or not this is an unusual number. And it does appear that this is an unusual number. The studies that are being done identify that more women than men have been affected, and more younger women, so women under the age of 55. So the policy, until more of this science is done, has been, yes, we'll use the AstraZeneca, but we'll only use it for populations over the age of 55,
where the risk of these blood clots appears to be less. So it's a complex situation. But when you look at the 14 million people in Europe who have received this vaccine safely, the numbers are very, very small. So looking at around 1 in a million, 1 in 500,000, somewhere in that range. So very, very rare.
Lana, your hand shot up faster
Well,
than
she's a little
I-
excited and very distracting.
You're on mute though. So now we're going to start doing a penny in the jar too.
Right. So thank you for that. So when I'm sitting listening to all of this, you know, my mom is an elder, so is her husband, and then I have the children that I have to consider when determining whether I should vaccinate my family. My mom has medical conditions, same with her partner. And the biggest concern that's coming from her is she wants to first of all know if she has a choice of which vaccine she can choose, because she's absolutely 100% at a no for anything that gives blood clots. I mean, when you get older and you're on blood thinners, and I mean, there's a lot of medical conditions that might conflict with these different vaccines. Her struggle is she doesn't know how to get the correct information to make the best decision for her. So her choice is ideally that she might not do anything at all. And clearly I have some concerns, which is why I have so many questions, because you know, I have kids right from 13 to 26. You know, my mom and her partner are over 75 years old. My partner has COPD. So, I mean, there's a lot going on. And then when you put in that there's side effects from all these different vaccines, I want to make sure that our families are taking the right ones, where they don't cause any other issues, right?
Right. Okay, you've got 3 different groups of people, and I'm going to deal with each of them separately. So right now, the vaccines are only approved for people 18 and above.
Okay.
Or 16 and above. So the Moderna vaccine is 16 and above. There are studies going on right now in the United States, and it looks like there will be approval for vaccine for people from the age of 12 to 15. So that would extend that 16 and over. Probably not until the fall though. So if you're looking at vaccinating a child in that age group, they'll likely be able to access vaccine once all these studies are done and safety is assured before the next school year. Your partner with COPD is exactly who we want to vaccinate, because the risk of vaccine is far, far, far less than the risk of getting COVID with COPD. It's when you balance those two out, there's no comparison. Your mom, I don't know about her partner, but she should have a conversation with her physician, because there are different choices, obviously, and depending on where they live and what's available in the community at that particular time, there could be a choice available. For example, in the Lower Mainland right now, some of the pharmacies are vaccinating people with AstraZeneca, but the health authorities are utilizing primarily the Moderna and Pfizer vaccines. So there may be different opportunities depending on where they live. But my recommendation is always to, if you're not sure, to speak to your physician, and they can help make arrangements for the most appropriate vaccine.
That was a question I had as well. And if full disclosure, you know, Lana and a couple other people from the office, you know, we talk about COVID every Monday morning, and we do an update for the team. Ewing does those actually, and he does a great job at them. But with all these questions coming up, we thought we should do a Q&A for the team, and actually, as Tribal Chief said, we should make this available to the public as well, because a lot of these questions are probably going to overlap. But sometimes the questions, they're coming hard and fast. There's so many of them, and they're multi-layered. For people who are just really concerned, really skeptical, and really unsure of how they're going to react to that, is that the only place that they can go, just to their physician? Is there anything else that they can do to kind of ease their, get their questions answered?
Well, this is one place where I think First Nations Health Authority has done a really good job. Two options. One is the virtual doctor of the day, which is a program that First Nations Health Authority has. Physicians who live and work in the region where you're calling from take turns being available by phone to have conversations with patients. The access numbers and I don't have it off the top of my head. It's on our website. So you call and there's a medical office assistant who takes the information and you receive a call back or a video chat with the physician that's on for the day. The other place where, like I'm doing today with being on a video, being on a webinar, we've been collecting the questions we get in the virtual doctor of the day. We've been collecting the ones from the webinars and answering them, and they're available on the frequently asked questions piece that's on the First Nations Health Authority website. So FNHA.ca on the COVID, it's under COVID questions.
Yeah, we'll post that.
Yeah, we update it very regularly as information changes.
Okay, great. We'll update that link and make sure that everybody has access to that as well after this. Yes, Lana, did you have a question from the phone?
I actually have a phone call message.
Okay.
Okay, Kate, go ahead.
Hi.
Can you hear?
I'm just wondering. Can you hear me?
Yes.
Okay. I'm First Nations, and I'm just wondering. I've had tuberculosis in the past a couple times and spent a lot of time in the hospital, so I have lung damage, and I'm wondering if it's okay to go ahead and have the vaccine.
All other things being equal, so I can't speak to any other health condition you might have, but somebody who has had a chronic lung problem is somebody we would target. Yes, absolutely, we would like you to have the vaccine because your lungs wouldn't necessarily be able to fight off a serious infection in a way that other people with healthy lungs might be able to.
So what about somebody with asthma?
I've got asthma. I was there in a minute.
Is that right? Okay. Well, it's good to know. I need to know that because So anyways, thank you.
You're welcome. Excellent. And I love that. We're taking live callers now. Lana, you're awesome.
All good.
I had a question on here from our comment section as well that says, if you are concerned about taking the AstraZeneca vaccine and you refuse to take it, will you be eligible to take Pfizer or one of the other ones at a later date?
Yes.
Okay, that's simple.
At this point, the way that the AstraZeneca is being distributed has been very limited. So it's limited to a certain age group or certain locations. And in the mainland anyway, right now it's only available at drugstores, and they have it in, there are certain populations of people. So individuals, how do I explain this? Before all of this came out, we were doing industrial work camps. We were doing people who lived together and worked together on a farm, some large industry groups. That's been put on hold until some of the science around AstraZeneca comes out. So at this point, those aren't being offered, but most of the health authorities have been primarily using Pfizer and Moderna. If those are the ones that you want, you can always ask when you go to register to see what it is
that's going to be available to you.
That's great that that flexibility is there. I had no idea.
Yeah.
I thought you get what you get and you don't get upset.
Well, I think that, you know, that people have been doing more research, and I would rather see somebody make a choice, a positive choice about getting the vaccine, than to be worried about what they're going to get.
Absolutely.
So, you know, we have lots of opportunity, and right now, in the next while, we have lots of vaccine coming into the province. So hopefully we have good opportunities
Okay.
for people to make those choices. But Lana mentioned earlier, and I didn't respond directly, she said, do we have a choice? Well, generally, everybody has a choice. This is not a mandatory vaccine program. So there are people who are reluctant or hesitant. That's okay. But my recommendation is that you do everything you can do to educate yourself, get good quality information. Sorry, Dr. Google doesn't count. There's lots of good information out there. Make sure you're informing yourself. Talk to people you trust, like your physician, like the community health nurse, and others who are available to you, who can support you in making the decision. And if your decision is still no, there will be other opportunities coming forward. I've had lots of people, when we did the first round in some of the communities, people are kind of, well, I think I'll just wait. I think I'll just wait and see how it goes. And if nobody in the community grew a tail or turned purple, then they were more willing. I'm being sarcastic, of course, but people were concerned, and they wanted to be sure that people they knew and trusted did fine. You know, they had a sore arm and the next day they were okay. Or sometimes people have felt a little bit fatigued in the first day or two after vaccine. That's something else that's been reported. But for the most part, the adverse effects have been very mild and very short-lived.
We should talk about side effects at some point. And also, I have a question just about watching out for misinformation. But I also saw Lana's hand shoot up in the middle there. So I want to give you an opportunity, Lana, to have the floor again.
Yes, Sherry Holmberg, she asked a question. If you're concerned about taking the AstraZeneca vaccine and you refuse to take it, will you be eligible to take Pfizer at a later date?
You already asked that, and the answer was yes.
Oh, did I?
I asked it, yeah.
Oh, so you're reading my questions too?
I have the questions too, yep.
Okay. All right, then never mind.
All good.
So I mean, you talked about you know, looking for reliable sources of information, and you know, I've also seen, you know, a number of, they circulate like YouTube videos or social media profiles, and that they kind of fan certain flames that might not be necessarily founded in accuracy. And how can people kind of mine through all of that information and find the information that they can rely on and count on?
One of the things I always tell people is to make sure you know your sources of truth. What are the sources of truth for you? And you know, maybe it's your physician or community health worker. Maybe it's First Nations Health Authority website. Maybe it's the BC CDC website, or the Public Health Association, or the Public Health Association of Canada, or you know, some the websites that are likely to be peer reviewed, likely to be based in science and fact. I want to be cautious here because I understand people's anxieties, and I understand that there are people who don't trust any of those systems. And I've heard that, sorry, from elders who say, you know, I went to residential school. My mother went to an Indian hospital. It was supposedly people we trusted who did bad things. And I need to acknowledge that and be comfortable with that anxiety. And I'm more than willing to have a conversation with people once, twice, 3 times or more, if that's what they need to feel comfortable with whatever decision they make. Be it accept the vaccine or choose to wait or decide not to get the vaccine at all. I just want to make sure that people are making those decisions in an informed way.
Yeah. One of the questions, and I guess this information goes both ways sometimes, but a question came in from Mark Anthony Lewis that says, what's with the COVID-19 vaccine safety survey? Apparently he got an email to complete the survey after his vaccine, and what's up with that?
The safety survey asks a few different questions. One of the things we really want to know is whether or not the circumstances of getting the vaccine were safe for you. We talk a lot about cultural safety and individual safety, and did you have an opportunity to ask questions? Was it a place where you didn't feel crowded by other people who weren't masked? All those kinds of things. They also want to know if you had side effects that you haven't talked to anybody about. For some people that have had serious side effects and either had to call a doctor or get some support, those have been very, very rare. Those ones we hear about. What we don't hear about is the person who says, you know, I should have let them use my left arm because my right arm, and I'm right-handed, was really sore for a couple of days. Or there's been one of the things that's happened for some people is they've gotten the immunization and then they've gotten a bit of a lymph node swelling in their armpit, in their axilla, which for many women is a danger sign in terms of risk of breast cancer. So people really got panicked. But we've found that many of those cases that have been reported within a day or two, that's gone. But they're actually warning people now before they get the vaccine that might happen, so that there's no panic phone call to the mammogram service, for example.
Right.
That, you know, if it's there and then gone in a couple of days, then you're okay. So there are lots of different circumstances that have come out. There are people that have had a rash. I've seen reports of that where on their shoulder or chest, they've had a bit of a rash. But for a lot of those people, it's a bit of an allergy to something called polyethylene glycol, which is a stabilizing component of the vaccine. But it's very common. If you've ever had a bowel prep for a colonoscopy or needed medication to make you go, sometimes it's in there. Some people have used it. It's often in over-the-counter medications. There's a little bit of polyethylene glycol. So if you have a sensitivity to that, you can end up with a little bit of the rash. It's not a serious side effect, but it is one that would make people notice. So the survey allows you to report on some of those things.
And since you're touching on side effects, let's have that discussion now. What are the side effects and how do people weigh those against the risks of COVID-19 itself?
Well, the most common serious side effect is an anaphylactic reaction. So that's a serious allergic reaction where their mouth may swell up, they may have difficulty breathing. And if you've had a history of anaphylaxis to anything, you should let them know when you go for your vaccine. Our staff and nurses and other immunizers are well trained in responding to that. They have epinephrine or other medications to counteract that. We've had very, very, very few cases of anaphylaxis in the province, but it can occur. So if you have a tendency for serious allergies, that's something you should be aware of. If you carry an EpiPen around, it might be handy to have it in your purse. But the staff would always have that available wherever you're being immunized. But again, very, very, very rare. For most people, the sore arm, absolutely. The needle goes into your deltoid muscle, which is the big well, mine's a little fattier than some, but that big muscle right there. You want an inflammatory reaction. You want your body to build an inflammatory reaction. So that might be localized redness, swelling, tenderness, and it may last a day or two. Some people have found they felt a bit fatigued the next day. Some people complain of a mild headache, the kind of headache that would resolve with a Tylenol. Some people have even reported a mild fever that disappears within a short period of time. So, but those are good reactions. Those are the reactions that tell you your body is actually building an immune response. Now, we have been warned. We haven't done a lot of second doses here, but we have been told that there's more commonly some of those side effects, after the second dose.
Okay.
So just to give people a heads up.
Lana, you had I think your hand went up at the anaphylaxis, which I know is something that you were concerned about yourself.
Yes. So I've never been able to have flu shots or vaccines due to me being allergic to eggs. So I am just very curious. I've always had to take something else or nothing. So I'm just really wondering what my options are, because I too have asthma.
There is no egg product in this vaccine. The egg product is something they use when they need to use a live virus to create the vaccine. And you saw the video earlier, there's no live virus in this vaccine. All right, there is a recipe for those little spike proteins, but it doesn't need to grow anything. So they don't need to use the egg product, which is the concern for many people like yourself. You keep trying to get out of this and it's not working.
I'll come up with some more questions.
I think if you have these questions, Lana, and I've said this to you before, I think a lot of people probably have them too. So I appreciate you bringing them up. This is a question that we received at some point last week, and I'm going to ask it in exactly the same wording. And I think there's probably some misinformation in here, but we should address it. But it says 1 shot of Moderna is now good enough, whereas the previous news was 2 shots are needed. What changed?
Let's stop there and answer that, and then we'll go on.
Yes.
1 shot gave sufficient immune response between 70 and 95%, right? But we don't know how long that's going to last.
Yeah.
Right. We haven't been using these vaccines long enough to know that we want a longer period of time when you're immune. So it's particularly important to get that second dose to make sure that you have the booster and the immunity will last longer. Okay.
And the second part of that question was about the delay in getting the second shot from the original projections that we were hearing in the very, very beginning.
Right. So the numbers at the beginning were recommending a second dose between 21 and 28 days after the original dose. Those recommendations were based on the studies that were done to have the vaccine released, recognizing that they were in a big rush to get it out the door, right? So what they were able to show was that, okay, after 21 days, people had built immunity, you get the second dose and you've had the booster and you're doing well. What they've been able to show since then is that those longer periods of time between dose 1 and dose 2, the dose 1 continues to grow in terms of immune response for a period of time. In Europe, they're waiting as much as 12 weeks in some countries between the first and second dose. So the decision was made for 2 reasons. One is that you could continue to increase your immune response for a period of time, and it would allow many, many more people to receive their first dose so that we could have that community immunity or herd immunity increase if we had more than 70% of the community
who had been vaccinated, the chances of transmission in the community are much, much lower. So it was a win-win that we could delay the second dose to increase the immunity and extend it, and it would allow for many more people to get their first dose.
And I just want to acknowledge before we go back to Lana, but a question here from Mark Anthony Lewis, and it looks like that question was just answered on the difference of scheduling. So Lana, what was your question?
Oh, shoot. I am not on mute. What about people who thought they had COVID back in February before it was announced? Is there a way to get tested to see if you had it? And if, say, there is a test and you do test, say, positive for having it back in February, do you still have to get immunized?
Okay, that's a 3-layer one.
Yeah.
Can you get a test that says you were positive for COVID at some point? Yes, but it's not readily available and would cost you hundreds of dollars right now. That is a test that we don't use a lot. We talk about it in terms of serology. So what it is actually doing is not testing for COVID, but testing for immune globulins that your body has made against COVID. So it's fairly complex. They were using it in research studies, but it's not commonly there. What we don't know is whether or not that level of immunity that you acquired by being sick, if you were positive, is enough to keep you healthy. We don't know that yet. So the recommendation is still get the first dose that would give you a booster. You keep trying and it's not working. You should get that first dose, and that, if anything, it would increase your immunity and not be a waste. Now, other people like me who have had my first dose and a subsequent infection, it probably means I have better immunity now than I did before. And whether or not I need the next dose is my next question. And the recommendation is still, yes, get it. That better to have too much immunity than not enough.
Right. Okay. We haven't asked yet, and we only have a few more minutes, but I think there's a couple threads to pull on still before you go. But just in terms of new strains and how effective these vaccines are on these variants.
So far, you have to understand that viruses are like teenagers. They change their clothes about every 16 seconds, right? So their job is to make themselves as transmissible as possible. So they are constantly mutating. Like, most of those mutations don't do anything, doesn't matter, but every once in a while they get lucky. So we know that the COVID virus has gotten lucky at least 3 times. One that we hear about quite often is the UK variant, or the United Kingdom variant, and that's B1137 blah. I can't remember the whole thing. And we know that it increases the transmissibility of the infection, and there's some evidence that the seriousness of the disease that you get with that is more serious than the original. And so far, the tests have shown that the vaccines are effective against that. The second is the South African variant, and it similarly is responsive to the vaccine. There's a slight decrease in the effectiveness of the vaccine, but there's still enough vaccine response to be effective in keeping people from becoming seriously ill. The one that we worry about, and the one that's transmitting in on the Lower Mainland right now, is the P1 variant. That's the one that originated in Brazil, and it entered Canada through travelers. British Columbia has more cases other than Brazil
than anywhere else in the world right now. So Brazil #1, and then BC. It may have more transmissibility and cause more serious disease and be less responsive to the vaccine. So that's another really, really, really good reason to get your second shot.
Right. The advice is still the same to get the vaccine.
And
Right.
once you have been vaccinated, and this is my song now, to continue to wear your mask, wash your hands, keep yourself distant from other individuals, and do what you know you need to do to keep yourself and others safe.
And how long will that last? These, having to continue to follow the same protocols. I'm sure a lot of us are just itching to hug our parents. And,
I wish I had the answer to that,
Mhm.
but I don't. I have a grandchild who lives in Winnipeg who I haven't seen going on 2 years now. It's killing me. There's only so many Skype calls that do the job, but I would much rather do that than risk taking the COVID with me to go visit. So yes, we'll be at this for a while, but the truth is COVID isn't going away ever. It is well established in our population now. So getting vaccinated, living in a community of people who have been vaccinated will significantly decrease the risk of COVID, but it's still going to be out there.
Yeah.
It's the nature of vaccines and the nature of viruses.
I think we should think about wrapping this up. So I want
Sorry,
to
Lana.
just, sorry.
Yes, I just want to have one more question. Sorry.
Oh, fine, Lana, you can have one more.
Okay, so now when we're talking about vaccinations and I'm hearing that you're saying that COVID's never gonna, not gonna go away. So we have to vaccinate. I've heard so many rumors, and I really need to ask this last question is, are we going to be mandated at some point? Everybody has to have it, or you can't access, different stores or whatever? Not going to be all.
I don't think so. There's lots of discussion about a vaccine passport. Don't know what that's going to look like or what it's going to be, or even if it's practical to do. But to my knowledge, there is no intention of making vaccination mandatory. What may happen is, like we get a new flu shot every year, we may end up getting a new COVID shot every year to deal with whatever new mutation happens to be circulating.
Okay, thank you.
You're welcome.
Yes, thank you so much. And I want to I know we've only got a couple minutes left, and I like to make sure that you get off and onto your next thing on time. But if you had 1 minute to kind of sum up your final thoughts here, what would they be?
Just continue to take care of yourselves. No matter what choice you make, you know what you need to do to remain as safe as possible and to take care of the people that you care about. So distance, mask, wash your hands, treat people kindly.
Excellent. Thank you so much. I will quickly just remind everybody who's here, if you've dropped in at the end, this was Dr. Shannon McDonald from First Nations Health Authority, Acting Chief Medical Officer. Ewing Teen and Lana Coldaway, both from Carrier-Suquehanna County Tribal Council, have graciously joined us and been working away in the background. And also Lana's had so many great questions as well, and bringing phone calls in as well. And I'm a communications officer for Carrier-Suquehanna County Tribal Council. And if you do have more questions, we would love to hear what they are. You can email me, communicationsofficer@cstc.bc.ca. You can leave them in the comments section of this Facebook Live. And if we notice that there is still a huge number of questions that need to be asked, we might ask Dr. McDonald again, or we might invite somebody else if her schedule won't allow it. But please ask these questions, and we will do our best to try and find the answers. So thank you so much to everybody.
Bye.
Merci. Bye.